Welcome back. Today is World Maternal Mental Health Day. It is a day to highlight the importance of checking in on new parents. For those who are pregnant, trying to get pregnant, or perhaps just had a baby, the stress of all of that, it just can be overwhelming and all-encompassing. In fact, experts say 1 in 5 new mothers experience mental health disorders during or after pregnancy. And that's just the number of moms who've actually come forward about it. Unfortunately, we know there are plenty who suffer in silence. To talk more about this, it's a super important subject, is therapeutic counselor Felice Hightower-Britt. Felice, thanks so much for joining us. Let's talk about postpartum depression. The conversation, I mean, it's starting to become more normalized. There really has been such a stigma around it. So what should new parents know about this? What are the things they need to look for, and their loved ones? Because it's a community thing. It's up to all of us to check on people.
You're absolutely right. Especially during this time, we have to be more cognizant about how we take care of each other. And really, 7 out of 10 women hide or downplay their symptoms because of the stigma. And so really what the symptoms are around postpartum depression are symptoms of anxiety, depression, lethargy, fatigue, crying spells, feelings of hopelessness, worthlessness, guilt or shame, too much lack of sleep and or appetite, women questioning whether or not they made the right choice about wanting to conceive and have a baby and wondering if they're doing a good job. And so it's very important that we talk about it, and that you mentioned earlier, Carolyn, that a lot of people really talk about postpartum depression, but what you mentioned was that it can actually start while you're pregnant. And so that's why it's even more important to be able to identify these symptoms early on.
I think it's also so important, just to talk about it, because I think the feeling of being guilty for having those feelings can be so much to send someone over the edge, to the point, too, where they just don't tell anyone about it. And that's when it can get dangerous.
Right. And so what we have to do is not give into the societal norms, right, about parenthood and motherhood, because really it's not always a happy, joyful experience. Now, it can be, and oftentimes it is, but we let that societal pressure dictate, right, our inability to come forward when we're not seeing those things for ourselves. Or if we're looking at social media and these mothers are seeming to be able to do it all, well, that's not real and that's not realistic. And so it gives us undue, unneeded pressure to perform and have a sense of perfection when it comes to motherhood. And so we downplay, a lot of women downplay their symptoms because they fall into that pressure.
I also think one of the biggest problems is when you first have a baby, you're sleep deprived. Your life is changing completely. Your body doesn't feel like it's yours. So these are very normal things. I think the problem is, how do you know when you're just feeling the normal, side effects of that, or when it's something more serious?
So one of the things is that if they're under 2 weeks or less, then you can probably say it's a hormonal imbalance and you're experiencing some blues, right? Postpartum blues. But if it lasts anywhere from 2 weeks or more, then you need to have a serious conversation with your primary care physician. And we also need to make sure we check on our men, because a quarter of our men also experience postpartum depression. So make sure you check in on them as well. But anything 2 weeks, at least 2 weeks or more, we need to start getting support and help.
Yeah, and just having these conversations and asking those new parents or parents who just had a baby how they're feeling, it's so important. Felice Hightower-Britt, thank you so much. Always such beneficial insight from you.
You're welcome. Thank you for having me.